All right, what's up, everybody? Welcome to Frank Analysis. I'm your host, Franco. You guys read the title. We're going to talk about Medicare for All and some information that you guys who are supporters of Medicare for All, there's a lot of Medicare for All supporters who are subscribed to this channel. This is information that you guys should keep in mind. Pretty much the main point we're trying to get across is to read the fine print. You can still be a supporter of universal health care or Medicare for all, the principle. Like, we're not going to tell you to stop fighting for universal health care. We're not going to tell you to stop fighting for Medicare for all. I'm still going to show solidarity. I'm still going to show up to events. But what we will tell you is to look at the fine print, look at who is going to be in control of our healthcare system according to the current Medicare for All bill, HR 1976, how it's written right now. So the guest who I have on today did really deep research into this topic and information you guys should be taking into consideration and what these powers are currently doing. We want to, like, just because we get a Medicare for all pass doesn't mean that that the ruling elite are no longer gonna have power. They're still gonna have power. Our focus should be on dismantling these people. So we're gonna get into all that, but I would like to introduce the guests today, Seb Solomon and Ali Alexandra. They both did a fantastic piece. Let me share the article for you guys real quick
It's
as
a long
well.
one.
It is, yeah.
Yeah, it was you can't put all that information in a short way, to be honest with you. So thanks for having
Yeah.
us on.
Yeah. So here is, you can follow Ali on her Substack. So the article is called Future of Healthcare Digital Ethiopia and China and Global Technocracy. Here is Seb's Solar Tsunami. You can follow both of them. But yeah, guys, how are you guys?
Doing
Thank you for being
well,
here.
doing well. Yeah, thank you for having us. Good. How are you?
Good. Say
Good.
hello to all the fans. We got the Yellow Brick
Yeah, I
Road
know, I'm
watching us
nervous.
right now.
So nervous. I haven't been on camera in a minute, so yeah. No, it's good to be here though. Thanks for having us.
Yeah, so something you guys wrote and warned about in this article is how the US healthcare system, more specifically the Centers for Medicaid and Medicare Services, or CMS, is pushing for something called value-based healthcare. And the current Medicare for All Act of 2021, or HR 1976, that progressives keep pushing for, has the CMS in charge of measuring the quality of services. So from what it sounds like some lives will be valued more than others if the CMS is pushing for value-based healthcare under this act. Now, if this is true, I mean, that doesn't sit right with me, because if somebody needs treatment, they need treatment. Like, I don't put other lives ahead of other lives. But yeah, go ahead and let us know what exactly is value-based healthcare, and we can also get started on that slideshow if you guys are ready to. But go ahead, however you guys want.
Yeah, she made some slides. She did a good job. So value-based healthcare is essentially, it's what it sounds like. It's based on the value of somebody. Now, you wouldn't think that it meant like a financial, like value, monetary value, but that's exactly what it means. It's essentially weighing the cost of you and the projected cost of you and what you will need in time with healthcare down the line. So if you're a demographic based on the data that's collected, if you're part of a demographic that doesn't have a great life expectancy based on whatever condition you have, you'll get the best care. They'll call it quality, best care, but it's the best care for your like bracket. It's not like in general the best care. Sebs, I don't know if you want to go into anything a little more with the slides, or Franco, if you want to play them, but that's essentially what it is. So it sounds great in theory, but as we'll get into a little more, it's a lot. It could get very, very sinister, I would say, in a sense.
Yeah, yeah, I would definitely agree with that. Yeah, it does sound good. However, it's just the fact that it'll be run by CMS, like you
Yes.
said, the Center for Medicaid and Medicare Services, will not be so great. And it's not, and this we said this in the article, but this is not to be confused with thinking that Trump's way was also any better,
Right.
because
Right.
he actually strengthened and gave more power to CMS as a
Yes.
whole. So and
Yes.
he said he loved value-based care, because he was like, oh, like, so we don't want socialist Medicare. This is America. Like, we love value-based. So to all of the people still riding the Trump train, keep that
Yeah.
in mind.
He was
Yeah.
not great for this either. And I mean, it's essentially, like, I'll just read an excerpt from the article. It's the way that most healthcare systems are set up. The business model is to offer as much service as possible. So that's kind of what we're used to right now. I mean, in some states, they have already implemented fully value-based care because of pressure, obviously to get paid by Medicare or Medicaid. But it's essentially paying for performance. Now, again, you'd be like, okay, that's going to incentivize doctors to, perform at their best. But when, as we'll get into later, an algorithm is ultimately deciding what care should be given to a patient, that's a problem. You can see how, it could be great. Like things like sharing information between hospitals and doctors' offices, that can be that's a good thing, because there's been experiences I've had where, like with my grandmother, this one hospital didn't know what was happening in a different hospital. So they're, again, once again, they're taking something that is needed and could be good, but as we'll see, the data is not going to be used for those, just purposes that we'd like to think. It's far more nefarious than that.
And it actually, on the Medicare for All, the Medicare 2021 bill, the Medicare for All bill, it's the Pramila Jayapal, and the one that's endorsed by a lot of the progressives and whatnot. It actually does say that all standards and quality measures under that specific bill will be overseen by CMS.
Yes.
So that is something to keep in mind. Then it says it, in fine print. So it's not a guess. It is a certainty if that bill goes through.
Yes,
So,
exactly.
And I just want to, get this point across to everybody, so that they can keep this in mind. You guys are supporters of a universal healthcare system, single payer.
Yeah.
Right.
It's just not. People shouldn't have to go mortgage their house because they, got cancer, or something horrible happened to them. But it should. I just also don't support the way that they would be implementing it. And if we really even think about it, it's like, do we really want a Medicare for All bill that was written by the oligarchs themselves? Because when they do say that that Medicare is okay, and when they push it through, it'll be because it's time for them, because they decide, not because they felt some sort of pressure or all of a sudden, found their moral center. I just think it's important to.
So they're trying to ride the wave while getting their getting their agendas passed through this legislation, right? Because all these legislations get approved by these lobbyists. It's something we have to remember. But yeah, let's go ahead and get started with the slide here, right? So what do you guys want to start with here?
Yeah, we can just go in order.
Yeah, we can go in order. And we're just doing this because Subs was kind enough to make this, because it's like, as you can see, it sounds like a simple concept, but it's not, and it'll all kind of tie together as to why data is the new money.
Yeah. And also for people to keep in mind, like we have like value-based almost everything, right? We like our social credit scores, like all that, like in order to, it determines like what kind of phone provider we get and all that. It's crazy, but it's not surprising that this is the direction that they're trying to move us towards, right?
Mm-hmm.
Yeah.
Yes. Yeah. And, for some people, this isn't new. A couple of friends have brought this to my attention. They're like, hey, there's already hospitals doing this, just based on your demographic, based on your life expectancy. So it's crossing this weird line to me where you have more and more machines and programs making these decisions based on kind of loose data about just a demographic. Like I said, we'll get into like more of that later. But all of this really kind of started underneath Obama, when obviously the passage. Yeah, so it was kind of started there, and another professor, Michael Porter, he's a business professor out of Harvard Business School. And that's who's kind of come up with how we're going to run the show here. So that should, a business guy is, of course, coming up with how this is going to work. So, a little cause for concern.
All right, so what do we got here?
Okay. Oh, so just from this is a quote from the Medicare for All Act of 2021. All standards and quality measures under this act shall be performed by the Center for Clinical Standards and Quality, the Centers for Medicare and Medicaid Services. So we wanted to point that out because a way that a hospital will now get paid under this system, if they hit, let's say, like 6 or 7 different quality measures, like reducing wait time or more access. It's these very, very basic metrics that you have to meet. Then the hospital will get paid, but that leaves them room to kind of like overcharge. Now they already do that anyway. So they're basically just restructuring ways that they can get paid more. But you also have private investors into this as well who have a stake in this game. So that's just kind of a way to open it up. And then
yeah, I was gonna add to that like, so basically, so before it was that they made money based on like the amount of stuff that they would offer. So they would be like, oh, test for this, test for that, test for this. And you don't really need it. Yeah. Then they would make the money because the insurance would pay for it. But now they're like preemptively saying, oh, if the hospital can save money and not give all these like tests that, you know, that they might find frivolous, however, but that someone might actually need, it's like to cut that preemptively. That way, it's like to save the cost offset, right? So they would save that money, and then they would save money on like if that person were to get really ill later on, they wouldn't have to spend more money on that person. So it's almost like preemptive, like healthcare, or that's how they think. It sounds good, but it's really not.
Yeah.
But yeah, so I just want to put that in there.
If you're confused, I promise this will make sense in a little bit. Because even just like as we went through this, we're like, whoa, wait, what?
From what it sounds like right now, it's like rich people's lives are worth more than, you know, poor people's lives, and they're worth saving more than poor people's lives.
Yeah.
And it'll be tied to impact investing. It'll be like health impact investment, which I know Allie wrote about and I've written about. And Alison McDowell is a great resource on this, among other things. But like human capital and social finance. So, but we can go to the next slide if you want.
Next slide, please.
Harvard Business School and healthcare.
Yes, exactly. This is a quote from Michael Porter, and you can see he's just talking about it's a business model, which we already knew. It's not like for-profit, you know, healthcare systems or anything new. But I think what I found most disturbing is not only, you know, I know people are going to say, well, it's not going to be like the current Medicare system if, you know, this new one passes. But like, again, you have to think, why are these people suddenly, you know, going to support it? These politicians, why would they suddenly support something that they've, you know, for years been like, yeah, we'll get to it. Of course, the pandemic has shown, you know, we've heard that line, the pandemic has shown us all of these things. That's what they're going to say to kind of bring this in. But the fundamental part about it is that there's not, the lowering healthcare costs doesn't mean lowering healthcare costs for you. It means costs for them. It's using these words that you have to remember who they're actually talking about. So if you've got a guy from Harvard Business School, the one that's really like designing this, which is essentially just a revamped like business idea that he's like, let's put it in the healthcare system. Why that happened is beyond me. You would just, you know, expect that care would be provided based on what a patient needs, regardless of their cost. So you'll keep seeing that word cost and don't think of it as like, oh yeah, they're trying to save me money. No, they're trying to save themselves money and sometimes get a return on their investment, which is a pretty penny. So yeah. We've just got this, just like little charts about how it works. And I mean, you can go ahead and research if you're, you know, interested more in Michael Porter. He's very, very established guy from Harvard Business School. But, you know, again, we have these people who treat everything like a business, and unfortunately you leave out the human aspect when you do that. So yeah.
So you're saying that doctors should have more say in this, or like more holistic
and
people,
the patient.
Right. but they don't consult with us. Instead they just get these business people to talk, because they view us as capital and livestock. It's absolutely disgusting.
And they come up with their metrics and then they decide, like, you know, just how it's going to go.
So if you get to decide if you're running the show and you get to decide what success is, and you can easily hit these measures and get a return on your investment and not have to spend a bunch of money in the business world and the business mentality, that makes sense. But you're dealing with people's lives here, and you're trying to pass this off under the guise of being more equitable. You'll see that word a lot. Giving more access, you'll also see that word a lot. Those things sound
Access.
good. Access, yes, access. You will see those a lot, and I'm always of the thought that when you see those people using those words, might mean something different. And as far as just assets, like things like that, it's all business, financial terms. So
Yeah.
All right, so we got here the CMS and the ACA, the Affordable Care Act. So pushing for value-based healthcare. Okay.
Yeah. So that's the Affordable Care Act, exactly, and that's kind of what Ali already said about the Obamacare.
Yeah.
What is it called? It started with Obamacare. A lot of it.
Pay for success. Yeah, correct. Yeah, you can go ahead. I kind of skipped around. Sorry.
Yeah, I mean they were praising Obamacare as if this is like this huge progressive thing. So yeah, this is like the next step.
Yeah.
When really, it all this does is giving corporations time to scheme so that they can come up with something that looks progressive on the surface, but really it's a giveaway for them as they continue to get more and more powerful. All right, so yeah, we got our friends here, Ezekiel Emanuel versus Gerard Wagner. This is a comparison that you guys did in the article here. Ezekiel Emanuel was a part of the Obama administration, right? Can you tell us a little bit more about this guy?
Yes, Ezekiel Emanuel is the architect of the of Obamacare, more or less. Like he is known as like the mastermind, whatever. He really likes using the like qualities, which are like the qualitative quantitative. I think like I forgot exactly what it stands for, but they're called qualities, and they pretty much measure like your worth, your value in life, and then whatever tier you belong to, that's like the best type of healthcare for that tier is what you would get, and it comes straight out of NHS, which a lot of people like to talk about as a good thing. NHS is the national healthcare in England. I believe it's all in all the Commonwealth countries, including Canada and Australia, and all that. But there was an interesting quote from Ezekiel Emanuel in one of these essays that he wrote, talking about how, basically saying how a 20-year-old person's life is worth more than that of like an infant, because the state has invested more money in the 20-year-old, so it would be more of a waste.
Jesus Christ.
Resource-wise, yes. Resource-wise, if a 20-year-old were to die versus an infant. This is straight up like what he said repeatedly, wrote like a whole article about it, designed Obamacare based on this ideology right here. And I'm not calling him a Nazi, but I did find it interesting that his quote sounded so similar to Dr. Gerard Wagner from Nazi Germany, from the Reich Doctor's leader. He was the Reichsdoktor leader that Hitler appointed, who also said that he had a very interesting quote. What did he say? It was the millions and billions that Germany has spent on in the past, about 1 billion marks, which was the currency they used back then, in Germany, to sacrifice the care of the genetically ill, and is a squandering of Germany's national resources that the National Socialists cannot justify when they consider the needs that the healthy population needs, the needs of the healthy population. Thus, we have it in good conscience before the world when we eliminate the lives that are unworthy of life. So, I mean, it's kind of an extreme comparison, but I mean, they're saying the logic leads to the same place. They're saying that some people's lives are worth more than others, and that we shouldn't squander precious resources on the lives that are worth less, valued less. Yeah.
And it just exactly. And to her point, again, that's the similarities between the guy that designed Obamacare. It's not like he's gone. I mean, he's still around. I believe he's active within the Biden administration. I believe. I'm almost positive. He is. Yeah.
Yeah, and he's in the COVID-19. I put it in the next slide if you want to go to it. Yeah. Go ahead, Ali. Sorry.
Oh no, that's okay. Yeah. These the quality adjusted life years. It is more morally.
But yeah, they're like, they see someone dying and they're like, oh my God, the resources, instead of going like, oh my gosh, this life, this all these experiences that they went just going away. or like this precious life, like this infant, what it could have been. But no, it's just like, oh my God, our investments. Oh my God, like that's how they think.
Yeah.
Because they think in capital, they think of us as livestock, they think of us as potential, as things that they can enrich themselves off of. You know,
Correct. And, yeah, just generally the healthcare system that's, purposefully incentivized by meeting specific goals that those same people are setting. There's no discussion of ethics here where that comes in. We haven't even gotten into the AI aspect of this. So it's all cause for concern. Again, I want to emphasize, we're not saying, no, just forget it. No healthcare for anybody. No, that's hardly the case. It's more, we should probably be paying attention to what will likely come up and go from there.
We need it to be the best bill that it can possibly be, not a corporate giveaway, for these creeps here, like it's Dr. Ezekiel Emanuel here, and he's still playing a role right now in our government. He's in the Biden administration, how you guys wrote in this article. So you guys want to tell us a little bit more here?
He's being considered for FDA as well, I think. I just saw that a couple of days ago. He was being considered for like some FDA position, and I'm like, oh my God, not this guy.
Yeah, and it's like, people could be like, well,
it's
that's
not surprising though.
Yeah, no, not at all.
It's not surprising. People could say, well, this is the worst case scenario. I mean, it's kind of not that dramatic. You just have to read the fine print, which is not a good time for everybody. I get that, but data is also really what they're after, which again we'll get into. But yeah, go ahead.
So yeah, these are the people who we have overseeing, what's happening right now with the pandemic and the lockdowns, right? And it's no surprise, what their interests are, which we can't get into right now on YouTube since we're live here. But I mean, look at what they're trying to push out, regardless of what the evidence says.
Yeah. We can go to the next slide and talk about the data.
Yeah, data.
Speaking of data, yeah.
Yes. So outcome, that's another important aspect. It's outcomes driven. So if you have decided what the outcome needs to be already, let's say we want to reduce hospitalizations over a 5-month span. And so then let's say they reduce, certain things. Like that doesn't mean like the population or people are doing any better. It just means that they met a metric that they set for themselves, which they have full control over how you get to that metric. So hopefully that makes sense to people. It's just like you have the same people who will benefit from all of this outcome. It's not the patient, it's the people running the show. Some of these other factors, as far as like, there's a big emphasis on meeting the goals of the population health. So that's kind of another way of just thinking about like the group versus the individual, which a lot of times, especially lately, we're always talking about, well, what's better for, isn't it better for the group? Then it might be better for the individual. But then you have to think about like the vagueness of some of these measures and some of these quote social determinants of health. So person-centered care. That sounds good, right? But it doesn't necessarily mean it's like actually, around what the person wants. It's more who's benefiting and who's playing a role within the person's care. So again, it's more just like taking from you, if anything. Patient safety, healthy living, effective treatment, care coordination, and care affordability. Those all sound great, but keep in mind that is based on whatever demographic you fall in, and then the quality of life that is given to your demographic. So depending on what you are, what all kinds of things, where you live, your education, your family background, that's going to be deciding then what kind of care you get.
Yeah, which is why they emphasize on collecting all this demographic data. They say it's for equitable reasons, but the way they use the word equity is for business. Like you are an asset that you're going to be invested in. So it's not equity as in like, oh, we're going to give everyone the amount that they would need in order to raise themselves up, to determine, for self-determination. It's more, no, you are an equity of the state, like you are an investment. And hence why even in the Medicare for All Act of 2021, I'm sorry, but they want the director of the Office of Health Equity to monitor, track, and make publicly available like all of these things. The disproportionate burden of disease and death among people of color, of different races, ethnic groups, tribal affiliations, like language use, English proficiency status, immigration status, like length of stay in the United States, sexual orientation, if you're homeless or not, and your socioeconomic status. Like they want
Jeez.
all of that. Like, and that's in the bill. So
Yeah.
like these things, you would be tracked in real time about like with all of this. So it's yes, I just think that's
So they'll be
important to
like,
note.
so they'll be like, who has more potential for, you know, for us to profit off of more, this white person or this person of color? Like, who's more likely to, you know, to die based off of all this data? This is crazy.
Yeah.
It should be
Yeah.
illegal.
Yeah. It's horrifying.
Very
Yeah, because I'm
right
sure
now.
there are people that are just like, why does this matter? It matters because you're gonna keep seeing this kind of language in the next, in the coming years, and it's all gonna come like with a smile and wrapped up in a bow, but it's not. This is horrifying. To think that just some, eventually some algorithm, along with a couple administrators and a doctor, we don't even know what medical education will look like in the future.
This is
It's
jaw
scary.
dropping. And this is what these legislators, these quote unquote progressive legislators, should be pointing out to us, as opposed to working class people like us pointing it out and telling each other how this bill seriously needs to be improved. I mean, this is really scary right here.
Yeah.
Scary,
They're
right?
valuing richer people's lives, or people of, depending on their ethnicity, more, depending on who these oligarchs can profit more off of. It's disgusting.
Yes.
What do we have here? CMS quality strategy goals.
Yeah, so I thought this was just an easy little kind of chart, like it's from the CMS itself. And so again, I'm going to keep going back to this point. Look at the language. So eliminate racial and ethnic disparities. So they could easily meet a new metric if they build a hospital or open some kind of healthcare center in like here in Chicago in a neighborhood that's predominantly African American. So there we go. We eliminated the disparity for like their access as far as like getting to a hospital. So they can make these like very basic statements, and then once they do that, they get paid and they get a return on their investment. Enable local innovations, strengthen infrastructure and data systems, foster learning organizations. I mean, these are just some examples, but it's like, look at the people we're working with here, look at their track record, and then see how they kind of take this language and make it sound pretty, and it's not.
And then like you'll see on the next slide, but it'll say like
Right here?
it doesn't. Yeah, that one where the Urban Institute is talking about whether or not this even works by their own standards. Like you can go ahead, Ali. I know you like looked into this.
Oh yeah. So they said it on their own website. These are supposed to improve overall health, symptoms, and well-being. They obviously don't translate into use of health, reduction of the use of healthcare services or the cost of care. But again, it's the cost of care to the provider, the payer, not necessarily the patient. But basically, it's not really taking care of the root causes of any of these illnesses, which that's something I've always wanted to be a part of the Medicare for all discussion is, of course, we want all of these things, like people to be able to manage diseases that they have, to live normal lives, to be able to go to the hospital or go to the doctor without, like, as I've said, taking a mortgage out on your house. The problem is some of these, why do we even have some of these diseases? Where are they coming from? We're not getting anywhere with that. And it's still the answer is like big insurance will come in and big pharma will come in and profit and do well. And so most of these clinical services do not save the health system money on that. They're already finding that it's not working, but there's still this huge push coming from the CMS of all people, all groups.
Yes.
So.
Which Trump loved, by the way. I just want to let people, because it's like it's just so funny because everyone, you think like, oh well, Trump, like he was against Medicare for all, but he strengthened the power of CMS. He loved CMS. He loved value-based care, like, and he said it. So it's like, I mean, I think most people have realized it by now. Like, this is not an outsider. Like, this is not, this is someone that was like with the agenda. While he was like hating on Obamacare and Affordable Care Act and socialist medicine, as he called it, he was pushing he loved Medicare and CMS and value-based care. So it's,
I wouldn't put it past him to not even know what the hell it is. He's just like, I love it. It's great. I love
It's
it.
surface level political theater to keep people in the two-party illusion. It's like giving people two different vanilla ice creams, but the only difference is that one has red food coloring and the other one has blue food coloring. And then you think that it's different flavors, but it's not. It's the same thing. But yeah, treatment over the cure, right? The
Yep.
but the cure would put these people out of business. So that's not what they're focused on. They're focused on treatment.
Hmm. And we can
Always,
go to the
always,
next.
always.
Yeah, this one's kind of saying the same, like with the equity. Even I think Allie, you found this one as well about that it has an equity problem, value-based care. Even
Yeah,
they
there's
say
an
it by themselves.
equity problem again. So it's just like it's like they're almost using half of these words or whatever just to say that like, yeah, we're, providing more equitable care. And so you look then at the ecosystem here. It's a little bit small on my screen, but you recognize all of those logos or a good amount of them. So that's kind of your players here.
Aetna, like Bright. We have
Amazon.
Amazon. Oh yeah, Amazon's about to make
there's
bank.
Apple over there.
CMS.
I see
is on there, of
CMS,
course.
Rite
Yep,
Aid,
you already know.
CVS. Yeah.
Yeah.
Remember CMS, guys. Remember
Yes,
CMS.
I
If you
swear to
remember
God.
anything, remember CMS.
Yeah, it's because again, aside from the fact that this is going to save people, meaning those, in that ecosystem, those people, money. It's the problem is the data, and we'll get into that, in a little bit. But data is kind of the new oil. It's the new money. It's very, very valuable. So what better way to capture as much data as possible than through healthcare, something that people desperately need, and they know that. So yeah, and so there's this aspect, just talking about finding the safety net. Hospitals and clinicians caring for poorer patients often get penalized in these programs. This happens because social risk factors are not included. So, but even when you do include the social risk factors, like I was talking about before, you can set these really easy metrics, and then boom, you're good. So you're a winner in the competition of hospitals that are most equitable, most accessible to people.
And since they're trying to save that money for the cost offset, because it's all based on the investment, it's like they're going to do as little as possible because that's the incentive now. Because before it was to do as many tests as possible because that's how they made their money. Now it's to do as little as possible, or the least amount that they have to do to just keep you alive. That way they could save money on on those tests and things, but then they can also save money in the long run, just in case you end up costing the state a bunch of money. It's kind of horrible the way that they talk about people.
Oh yeah, we're just like
sad.
we're just in the way. It's we're just these pesky little problems that they just have to keep treating. Like we just won't go away already. So.
They have to figure out ways to keep tricking us into thinking that they're listening to us.
Yes.
But no.
And the next
healthy people.
one,
Oh yes, healthy people 2030. So yeah, tell us what this is all about.
So this, it was another thing I found. It's an objectives kind of another program, because especially this crowd that's in charge, they love all of these different platforms and programs that they can, brag about to their donors, get more money. But the points that at least I was making with this is who's coming up with the measurable healthcare objectives? What's the outcome that they're actually going for here? Is it just quote, be healthier? Because that could mean a lot. What are the broad global outcome measures? Why aren't all of these questions that I've got here I'm not seeing anything about just the patient. What does the patient want? When the patient gets brought into the hospital, do they have any say in the care? I'm not saying, of course, that they're going to know more than a doctor, but again, how many times have you actually seen anything about physicians in all of the slides, including this that we're showing? There's really almost nothing.
Not a single one.
Yeah, there's almost nothing about just the patient and the doctor. So I can't, my screen's messing up, so I can't zoom in that much. But this, it's just essentially a framework of how they set their objectives, measures, and metrics, and then once they meet those, they get paid. And they didn't, have to spend as much on you. So hopefully you fall into a good demographic that is worthy of receiving, the highest quality of care. That's, I say that and I laugh, but it's very horrifying. It's again, I can't emphasize this enough how I'm really nervous about what's going to come with this Medicare for all bill. I know there's people that say it's never going to pass, but I don't know about that. Sabs, do you have anything to add?
No, you covered it pretty much.
It's just a lot.
I was going to say the next one was about the AI.
Yes.
In hospitals. So
that's another. Oh, go ahead.
I was just gonna say, why do we even need artificial intelligence in the hospital? I mean, it could be a good thing, but then again, who is in control of it, right? Because it's a tool, but who's controlling that tool?
exactly.
Well, the
Are we
company is called
testing
Epic,
it?
if you want to
Yes,
know. It's the
Epic.
biggest one. It's called Epic. They will be the ones setting the algorithm. Yeah.
Yeah, so it's like, of course, like there's a lot. Like I want to just make it clear, like we understand there's lots of good things about technology that has come into medicine. So I'm not saying just get rid of it all and go back to like 1905. No, but it's the fact that what you're going to ultimately be seeing more and more of, because you have lots of doctors that are quitting because it's actually it's really hard for them to operate in a value-based care system as an independent physician, because you're getting so much pushback from the government, from CMS, to aggregate all of this data. If you're a one-man operation or a small doctor's office, that's a ton of money, a ton of resources to put in to these cloud-based systems. So it makes more sense, financially, for doctors to join larger hospital groups, and that's where you're going to see a lot more of this artificial intelligence in healthcare. So again, it's not the fact that, of course, it could be a great thing. You could just walk in and get, scanned and be like, hey, do A, B, and C, and you'll get better. But now the point that we wanted to make was that you've got all of these measures that are actually not equitable in any way, or how they've co-opted the language. You've got that, then this kind of like AI systems that are, dictating what doctors are doing and administrators are doing more and more. That's cause for concern.
And the article that you found, Ali, about the two doctors that they wrote this article, I think they're two doctors, or I think maybe professor, but they're doctors anyway, at the medical school at Brown University. And I thought that they brought up an interesting point when they were talking about the AI algorithm that was helping them out, or technically supposed to be helping them out in the triage, for the triage on the emergency room. And they were saying, although the AI has the potential to improve inpatient care by highlighting new links between clinical data and outcomes, it could also over-sensitize young physicians to specific tests and health factors that the algorithm deems important. It could compromise trainees' abilities to hone their own clinical intuition. In essence, physicians in training would be learning medicine on the algorithm's terms and disregarding their own intuition. And to me, that's pretty serious.
Yeah.
Like you're playing with people's lives now. So I don't know. It's like, I'm not saying that it can't be useful, but it's like, I think, Ali, I remember you wrote the section about how, like doing the thought experiment of like, okay, like you go into a hospital, you're in, such and such tier, right? And then it's an AI run triage and you need help, right? But based on like where you fall in the value system, you'll be placed where they deem you appropriate.
Yes, so, exactly.
Yeah, go ahead.
No, I'll read that. I said, let's do a thought experiment. What if someone with a low value is brought into the emergency room because of the hospital, or with the AI system, because of the value of that person's life is diminished based on their metrics, of course, their lifespan conditions based on the algorithms. This person won't be worth any extra investment, and they will likely be placed into a category of people who receive minimum but quality care. So you're given the best quality of care, but only in their terms. And, honestly, the point is these are the types of issues that they're not being discussed in a lot of discussions with Medicare for All. And to be honest, I'm sure a lot of people don't even know about this. I know that people like people that work in healthcare know about value-based care. And I'm, even I would love to hear more of the audience if they, work in healthcare, if they already have experience with this type of system. The feedback I've gotten thus far has not been great about it. So,
Same here. Same. The next one. Go ahead. Sorry.
Yeah, I was gonna say, I guarantee that more than 95% of people who are supporters of Medicare for All don't even know anything about this. All the information you guys are sharing here, and it starts here. All right, so we're discussing it here. You guys wrote your article. Now that more people can find out about it, share this information out to more people, because we do want to have if we actually do want a universal healthcare system that is going to work for us and not going to be something that's going to be a giveaway for these corporations to control our lives, we have to read the fine print. We have to
Yeah.
make sure they're not going to be taking advantage of us like how they did with the Affordable Care Act, except they're now evolving with this Medicare for All. But yeah, go
Correct.
ahead. What do you guys want to say here? How did public health and domestic terrorism become intertwined? Yeah, how does domestic terrorism, what does that have to do with this?
Right. And just, I mean, I remember just using this picture. Again, this, yeah, is extreme, but given everything we know about data and how that's being used to ultimately determine too many. Oh, I was going to read that comment. All of this data that's going to determine separate like, outcomes or whatever. What if you are listed as like you voted for Trump or you're opposed to COVID measures, and then you walk into the hospital and say like, I need help. They look you up. Ooh, you don't mark right there. Like your little group isn't really high up on the list of like who would really need that care. That's a problem. So again, it's like we're seeing this massive just like data grab, and it's all being fused together to kind of determine the value that you have. What kind of problem are you going to be? How much money are you going to cost? Such like that. So that's kind of why we wanted to point it out. I don't know, Stubbs, if you want to add anything.
Yeah, I was going to say, like, it's kind of, or even, you could even say, like, what if this is kind of out there, but like, what if your web browser history is tied to your, to your electric health records, right?
Mm-hmm.
Electronic health records. And so it's like, but what if like it's, there's something that's mandated and you feel kind of skeptical about that thing that's mandated, and are you going to be considered a domestic terrorist? Because look at this, where they're saying, was it potential terror threats, like opposition to COVID measures? Like, what is that? So,
Right.
So like what, like the measures include things that you're being mandated to do that you maybe choose that you don't want to do.
Yes.
So, and speaking of, we're going to talk about Australia in a little bit, but just to mention Australia and like, because people talk about like Tulsi's Medicare for All plan versus Bernie, whatever, and I get it, but let's look at what's happening in Australia right now. Like, and I'm not saying just like, oh, the lockdowns, yeah, like absolutely the lockdowns too, but just like the way that they're treating it and the way that they're able to do it. Yes, it's an island, it's small, they can do these things, but Australia's healthcare is like totally digital.
Yeah.
It's totally digital. That's like a lot of the reason why they're able to do the strong measures that they're doing right now is because of the way that their healthcare system works.
Yeah.
Seriously. And it sounds crazy, but it's like, so before we like say, Tulsi or, had this and Bernie had that, like, let's look at the places that they're trying to model after.
Yeah.
What's happening right now.
Yeah, it's important to like.
Point that out.
No, that's a good point. Yeah, like just taking even a bigger step back than just the United States, so just kind of looking at it on like a fully global level and seeing how it's being rolled out, especially in like the Five Eyes countries like Australia.
Mm-hmm. Yeah.
And also look at how they're like, even now, right now in the US, they're discriminating. Like there's some doctors that said, I'm not going to treat any patients if they're anti-vaxxers, if they didn't get the vaccine.
Exactly.
They can get a record of that with this and see like, oh, are they against these vaccines? And then if they are, then we won't prioritize you. And that's to me it seems fascistic.
Yeah.
They shouldn't be in control, over who gets priority or not. If somebody needs to be taken care of, they should be taken care of regardless of what their beliefs are.
Yeah, that's what we like to think when you go into a doctor's office or when if you have to go to the hospital.
Yeah, and then this is for so they were trying to pilot, I guess, putting Medicaid on blockchain. So essentially putting like all of your electronic health records, your history, all that stuff on the blockchain in order to manage it better. But it sounds good, and they talk a lot about like interoperability. That's a word that you'll see a lot, but so they want to. So basically, like how you have a Bitcoin token based on, I guess like whatever you. I don't know exactly how I guess you'd go to the exchange, whatever. You have Bitcoin tokens, but instead of like the token representing like money, like value, it could represent like something you've been diagnosed with. So that's how that would work on a blockchain if you were to put electronic health records on blockchain, which they really are trying to do.
Yes.
That will come soon. That's how it works in Australia. So
it's a lot of info to take in, but it's
All right,
Yes.
blockchain-based genomics, nebula genomics.
Yes.
Um,
So yeah, blockchain-based genomics is basically putting your DNA genome, like your sequence, your DNA sequence, onto a blockchain. And so they're saying this is because, oh well, we want you to be able to be in control of your information. But it's like,
Mm-hmm.
okay, like who's even in charge of this? So
Right.
you look at it, and it's the guy George Church, who has ties to Epstein, who at one point wanted to create like a genome-based dating app, which is like eugenics light.
Yeah, no, it really is. Really is.
who's the best match for me? Who am I gonna have the best babies
Ooh,
with?
yeah,
Yeah,
right. And it would literally just match you up with the
yeah, like
best
who
match.
exactly. And then, so this is just, I wanted to point this out because this is another company that's tied to Epstein, or another company, another person tied to Epstein, who's also using blockchain. So it's like, it's just very strange because before I wrote about like the 5 million kids in Ethiopia who were put on blockchain for education, and it was done with Cardano, which is partnered with Singularity, which is Ben Goertzel, and ICOG Labs, which is Epstein, who Epstein's foundation like founded that. So it's just interesting, all these things that are coming together, like who they're tied to.
Yeah.
But yeah, we can go to the next slide as well. But they also talk about precision medicine is the reason why they want to. Yeah. So
just real quick, they'll just zap you real quick and you'll be fine. I don't know, when I think of the words they use, precision medicine, and it's just like, oh god, this is not good for us.
So the next one I wanted to point out. Sorry.
No, it's okay.
Can you guys hear me?
Yeah, you can hear you.
I lost connection for a bit.
Yeah, no, I was like, uh-oh. It's been a while. Next slide, please.
But yeah, one way that they try to sell this is by saying, oh, like you can have specific diseases depending on your genetics. So they try to sell people, yeah, you got to know what your genomics say, like so you can share it to your doctor, and then they can work with you and be like, all right, you should need this specific treatment. But I don't know. There's a lot of pros and cons here, and of course, like in the hands of the wrong people, what can they do with this, right? I'm not gonna trust them. But yeah, Brock Pierce,
yeah,
Epstein, MIT. Okay, tell us more about this.
I wanted to point this out because it's just another thing that's tied to Epstein that has to do with like blockchain, because Bitcoin obviously runs on blockchain. I just thought this was interesting. I guess Brock Pierce ended up he's the board or he's the foundation board chairman for Bitcoin, and this happened in 2015, and it was just interesting because I'll just read out. It was like another stand may connect Epstein cryptocurrency and indirectly to Brock to Pierce. In 2015, Joy Ito, the then director of MIT Media Lab, which a lot of like this, there's a lot of things coming out of MIT. It's like, I think Alison McDowell says it's literally the war machine.
Yeah.
As far as like legacy universities go. So they announced, MIT Media Labs announced a digital currency initiative, and then just days after that, Ito, who was like the head of MIT Media Labs, or the director, he announced Pierce, or he named Pierce to be the chairman. But then right after that, Ito had to resign because of the reports of how much money Epstein had been like donating to MIT Media Labs for his specific like digital currency initiative. So I just want to put it out. Like I know people like to say that this is like our liberator. It's going to free everybody, but let's look at the players that are behind the curtain, kind of pulling the strings. So I just thought that's
interesting. Yeah,
that's a little interesting tidbit. Just more Epstein related.
Yeah, because everybody loves Epstein.
Epstein is connected to Medicare for all. Are you kidding me?
Basically.
Well, Bitcoin.
Yeah.
Okay. Then, this is one more genomics market run by it's called EncryptGen, and it's founded by David Kospel and Vanessa Gonzalez, and they basically want to offer you DNA tokens in order to incentivize you to get your genes sequenced or to get that data. And then I just wanted to point out that Vanessa Gonzalez, one of the founders of EncryptGen, is, or she was, the director of Latino leadership and engagement at Planned Parenthood. So I don't know if anybody knows or people know the history of Planned Parenthood, but I just thought that was interesting because it was like a eugenics. The way, I'm not saying that's all that all Planned Parenthood is. I'm just saying like she was probably she's high up there, so it's just I just thought that was interesting. And then David Kospel, he's also one of the founders. He's also a venture partner at this place called Impact Rooms, and they support Africa's impact ecosystem, specifically in Ethiopia. So I just thought that was interesting, like just another connection. He's also a bioethicist and an attorney. So he tries to like pave the way for hospitals to adopt like AI and blockchain and like Internet of Medical Things, like
Lord.
IoT. Yeah. So he's like an attorney that pushes for this kind of stuff. So I just thought that was interesting for someone who's like an ethicist, kind of spearheading some of this stuff.
So this is tied into, how Ethiopia is a testing grounds for a lot of this stuff where they test out the Internet of Things. And now what you guys are telling me, the Internet of Medical Things.
Yes.
But yeah, guys, if you don't know what the Internet of Things are, just look into, a lot of the work. You Sebs and Ali talk about this a lot. Who else? Ali McDowell.
Yep.
And Whitney Webb.
Whitney talks about it. They talk about Slow News Day talks about it.
Slow News Day,
yes, Gloria.
Gloria. It's. I mean, at this point, it is pretty easy to find. The Internet of Things essentially is just like inanimate objects talking to each other. You already kind of have some of it set up, but
smart things.
Smart
like
things,
they have. What's her name? Becky. What's the Amazon lady?
Oh, Becky.
Alexa.
I don't want to call her Becky though. Becky. Yes, Alexa. Yes, Alexa.
Yeah, our phones can talk to us like there's Siri and all that. But yeah, they're trying to expand it, to more smart technologies. Like your house can talk to you and all that.
Yeah.
But yeah, we were talking about Ethiopia. Oh yeah, go ahead. Sorry, Seb.
No, it's okay. I was going to say I wanted to point that out because the last guy that we were talking about, who is also one of the founders of that genomic, the EncryptGen, he is part of the Impact Room, and they had highlighted Ethiopia, and they had highlighted the Ethiopia, Digital Ethiopia 2025, right? Saying like, and that's their president saying this, or their prime minister, Abiy Ahmed, and he was saying, Internet of Things, like artificial intelligence, nanotechnology, big data, like all of these things are going to be super important in the future. So we need to implement all these new technologies into like our agriculture, manufacturing, like IT, digitally driving tourism, digital IDs, which they did because they put 5 million kids so far on blockchain. But that same company, Cardano, is also trying to put the whole country of Ethiopia onto a national, so like 120 million people on a national blockchain based digital ID system.
Yeah.
So yeah, I just thought that was interesting how all these things are connected, like just
like on a level that
yes,
people don't even realize.
Yeah, imperialism, Epstein, surveillance, the Fourth Industrial Revolution. It's all connected here. Medicare for all. These fake progressives, these Justice Democrats, and how they try to push for things like this. It's also Sunrise. The same players are involved in all that.
In the green, yep.
Yeah.
I was going to say for the reason why I wanted to include a lot of the genomics market stuff is because the way that they would want it to work out is basically as soon as you're born, you become like a liability. You're an investment, right? So everything that you get or like how you're going to be treated, what have you, will be based on like who you are on this like data system, right? Like, or this and they can do it on the distributed ledger, which is the blockchain. It's not inherently bad in itself. It's just the way that it's being used. It's a brilliant technology. It's just the nefarious way that it will be used. It's just it makes it too easy to be nefarious, So basically, like as soon as you're born, like based on your genomic data, your socioeconomic, status, all that stuff, which they'll have, they can make predictions about you, because you're human capital, right? And they can, since you're an investment, they can make predictions. But the thing is, a lot of these investments and these health impact or social impact bonds that people invest in, they're securitized. So, which means it's basically what happened in 2008 with the bust, right? So when if shit hits the fan, like if somebody's investing in your good outcome, somebody might be investing or leveraging against your bad outcome.
Yes.
And this is people's lives. So,
yeah.
Yeah.
Like, no, I was just gonna
point that out.
add on that. That's exactly how they're making their money. They're paying for these outcomes, but then you have people that are betting, essentially, betting on this. They already do that now. It's moving more and more into just human beings in healthcare. So, this group doesn't look like it's going to do well, but hey, this new technology might help them. So, this group will, be supportive of that. The other group, it's like, nah, I'm not seeing it happen. So then you've got all these different influences in what these outcomes are. It's just, again, like the bigger picture here is, again, like these ideas are great. I'm not saying just like get rid of it all, but we should be paying attention to not only the politicians. That's fine; those are the front men of all these corporations anyway. But just everyday people that are contributing. I mean, in a way that they don't even realize because they're all in silos, like contributing to these larger systems. That's why I sometimes say like it's really all of us, that we are all continuously contributing to this without even knowing it, because people are in their silos doing their thing, just trying to work, take care of their families. That they're not seeing the bigger picture that we're all contributing to, which is not being used, in my opinion, for the best of intentions. I can't get over the way that they use language like value-based care. Doesn't mean that they think you deserve to get the highest quality care, of all. It's just based on who you are, which not in a medical way is what I'm saying.
And then depending on what team they root for, they settle for certain things like the Affordable Care Act or the current Medicare for All bill of 2021, HR 1976, and then they're like, all right, this is good enough. The people who I support are promoting this. The candidate who I love, Bernie Sanders, is promoting this. And then they don't look at the fine print and how, they have all this stuff here that can F us over, and they don't let us control our own fate based off of these algorithms that can predict whether you can be worth investing in. It's crazy. Like, they're not letting us even determine our own fate.
I think that's the fundamental problem, at least for me. It's that idea of not having any really say in your own life, like the last,
no agency,
like the one thing that you should have like some control of, even your environmental factors you can't prevent, but like for you, just your own body, like a decision that you make. Oh, hey Charles, just saw the Lone Wolf podcast. Anyway, the choices that you make now at this point will be refuted, because don't you trust the science? Well, this little tablet's telling me that you only probably got a few years to live. But let's say there might be some drug that they could use that would help you. You know what I mean?
They'll be like, well, based on your social determinants of health, like this is the category that you fall in, as if like human beings can't change. Like it's assuming that someone is just like, you're born this way, this is how you are, that's it. And it's like humans are malleable. We can change. We can do whatever we want. Like,
and it doesn't require them to change at all. Why is it, they'll say African Americans are however much more likely to get something like diabetes. Then it's like, okay, well, let's look. They'll say we're looking at the social determinants and they're not around quality food, blah, blah, blah. But it's like you have these people that created these problems that are just rebranding it and then saying that they're here to fix these problems is the point. It's like, because they actually have the most to lose from real change that comes from actual, just everyday people. They have the most to lose, which is their investments and their money.
Yeah.
So yeah, you can go to the next slide.
The WEF,
our favorite group.
Yes, the World Economic Forum. So in 2016, they put out a thing about all the emerging technologies, and they do this every year. But I just thought that year was particularly interesting because it has all these things that were, that are kind of becoming more mainstream in the last, 2-3 years. So like they were talking about like the 2D materials, like new materials like graphene, blockchain, optogenetics, Yeah, open AI ecosystems, like Internet of Things, Internet of Nano Things, nanosensors, and what is it? Internet of Nano,
Yeah.
Internet of Nano Things. Yeah, organs on chips, autonomous vehicles, like just all these things that even the World Economic Forum obviously has been paying attention to.
Oh,
And
yeah.
yeah, so we can go to the next one. So I wanted to break down just like the graphene, how because they do talk about 2D materials, like up and coming ones. And but graphene is essentially, it's a carbon based material that is, it's like hexagonal, kind of looks like a beehive kind of thing. So it's one of those things. There's like a little short video about what graphene is. We can watch it if you want, but basically it's something that is going to be very relevant more and more, because it's something that it's conductive. It can be used for different things, especially for like the Internet of Things. We can actually watch the video. It's only like 2 minutes.
Sure. Is it in the next slide here or where?
It's that one, the first one, that one right there.
And if you're confused how this goes in with healthcare, I promise it will make sense.
Yeah.
Where is the?
It should be under graphene.
Yeah, the next
video.
I think it's the next video. It's that.
That's the video
Yeah.
right there. Yeah.
Oh, okay.
I know it's hit it.
see.
Yeah.
Sorry.
I may not. Can you hear that? Could you hear it?
No,
Oh no.
that's okay.
It's okay if not.
That's okay.
Yeah.
That happens.
It's not
But
a big
it's
deal.
I can post it later. Yeah, it's in the article actually. There's a link to it. The graphene. Go ahead, Subs.
Yeah, so basically, it's just graphene is like it's a two-dimensional material. It's a class. What how do they say? Known as a two-dimensional material. The class has grown in the past couple of years to include lattice-like layers of carbon, graphene, or boron, or hexagonal boron. So basically, it's something that, and you can go to the next slide because it also talks about graphene. But because I know there was some talk about graphene being in the current COVID, we'll call it treatment that they want us to take. So I just thought, and I know that some people were saying, it's not real, it's not true, it's not this, not that. I'm not here to make any judgments about that because I don't have electron microscope. I don't have these. I can't do it. I can't look into these things myself. However, I did find this about graphene. The Royal Society of Chemistry, which is the UK, they have been studying functionalized graphene oxide to serve as a novel vaccine nanoadjuvant for robust stimulation of cellular immunity. So basically, they want to use it as an adjuvant, which is what would help, penetrate it into the cell. Yada yada. So it is something that they are studying.
Yeah.
Just FYI. However, even on their own website, they did point out that graphene oxide aggregates in biological liquid induces cell death, and it also exhibits poor biosolubility and biocompatibility. However, they're working on that. So it is toxic. However, I guess they want to try it out. They think that graphene oxide is better for it's like better for immunity. That's what they're thinking is. I think exactly what they said was graphene oxide used for the delivery of biomolecules, excels in loading and delivering antigen, and shows the potentiality of activating the immune system. So that's the potential that they're saying, but then they're like, oh, but it will cause your cells to die and it's not biosoluble or compatible. So take that for
Hopefully they test it out and we get enough evidence and they don't just roll it out and then they just have it it's not even approved and then they just distributing it, just like something that they're mass distributing to people.
Yeah, something else that's not.
But they also have been using graphene in water filtration systems, and it's really strong. So I guess they're using it in and they use it and it's conductive. So they use it for for anything like really thin, if you want to put like a screen on like a glass or something, that would include the graphene.
Yeah.
So you can look into that. I think it's something it's supposed to be the new silicone. So you know how there was like plastic age,
Yeah.
and it's like silicon like kind of took over. Graphene is next. So it is something to pay attention to.
Oh yeah.
Yeah, even if it's not just like for whatever vaccine thing that was happening. So
Yeah.
yeah, and then another thing that the World Economic Forum talked about was optogenetics, which is basically like using light to control the brain. And the most common,
great.
yeah, so the most common methods of, I guess, implementing this or doing this is by virus or in vivo, or I think like 2 other different ways. So I just thought that was interesting.
Oh yeah, electroportation and generation of transgenic animals.
Yes.
Viral approaches have become the most popular due to their rapid generation and ease of use. So I just want to point this out again. It's like, because if anyone's like, well, what does this have to do with Medicare? Well, it all really does connect, again, with the data and just how, if you are classified as, this person, who knows what the hell they're going to try on you. I mean, that's just what I kind of gather from it. There's other aspects too, like just like as far as like optogenics and stuff. You can go ahead, Sebs. But
yeah, no, I mean for sure. I mean,
out.
it's definitely it's a type of it is something that they have been experimenting with for quite some time. Just as far as like on animals and stuff, of course. Well, so they say. But James Giordano talks a lot about these types of weapons, as far as like neuro weapons and things. So he's a bioethicist from Georgetown University. If you ever want to look him up and get freaked out, that's always fun.
Yeah.
So he talks about like using either frequencies or light or different things to mess with your neurons, right? So because we are very, what is it? Well, we're resonant beings, right? So we're electric beings.
Yeah.
So we are affected by light. Whatever kind of light, whatever it falls on the spectrum, whether it be microwaves or radio waves or infrared or gamma rays, what have you. So I just wanted to point that out. I just think that people should probably maybe like pay attention to these type of things, because this is where it seems to be headed as far as like health goes. I know it sounds really like Star Trek, but it's real.
Oh yeah, it's real. It's a real thing. A lot of money, billions of dollars going into research over this stuff. Yeah. So they're not gonna, that's like, I mean, it's cliche, following the money. It's a pretty easy way to kind of see where things are going, because they're not going to invest billions of dollars into something that they think will fail.
They always get these people that come from these intelligence-funded universities like Georgetown to be like the speakers on ethics, right?
Yeah, isn't that funny? Right.
Yeah.
The tipping point. What does this mean?
So
they have
these
plans here.
So this is the World Economic Forum saying they had like some tipping points for certain technologies, and I just pointed out a few. So they said by 2022 we'll have adopted the Internet of Things, like wearable internet, like 3D printing. They said by 2023, implantable technologies and governance, and on blockchain and the blockchain. So they talk about decentralized governance, decentralized finance. And then by 2027, they said Bitcoin and blockchain would be completely integrated into the structure of the system that we currently live in. So I just thought that was interesting.
Yes, and it's going to be running on a lot of data that is going to be collected, that already has been collected by even places like the Centers for CMS. So, because we already know this is the era. I mean, it kind of was before, let's be honest, but Biden is most, certainly proud of the fact that it's the era of public-private partnerships. So that's another emphasis I forgot that I wanted to point out, was that you have all of these companies very easily exchanging data with the government and vice versa. I mean, Amazon Health, look that up if you sometime, if you want to see what they've been up to in terms of how much they're going to benefit in the coming years, because they have the data, they've got the cloud capacity, and CMS wants that data, because the more data they have on people in general, the more these algorithms are supposedly going to provide the best quality care for all of us. So.
Yes. We can go to the next one. So over here, I want to talk about some of the foreign investment in research and development in China, specifically with nanotechnology and synthetic biology, because we're talking about health, and we need to talk about what they've been researching and where. because I know a lot of people will fall into the whole like, China bad, this or China good. Just kind of there's a lot of polarity there, but let's not forget that a lot. I mean, even this report was from like 2004, I believe, and it's done by the Stimson Center. It's a think tank in DC, and they were talking about all the different foreign investments that were going to go into China, and it was like what is it? It was like biotechnology, artificial intelligence, like data analytics, logistics technology, robotics, brain computer interface, like advanced materials, like the graphene that we were just talking about. Yeah, so it was just a lot of different things that were invested in China because they had the open door policy after Deng Xiaoping, I guess is like in the 70s, where they were they wanted that investment, and it's hard to live in isolation. I completely understand, and of course, like you can't think of whatever China did in a vacuum because it was happening, in a bigger geopolitical context. But I just wanted to point that out because then it's just funny because like all the stuff that was researched and developed and on cheap labor and a lot of deregulation, which Ethiopia is now doing, right? So it's just interesting how countries, when they're trying to, I guess, develop, or their version of develop, the kind of sacrifices that they'll make. But I just I wanted to stress the fact that before people go around saying, oh, well, we're just going to get a social credit score like they do in China. Like China's coming here. China, the Candace Owens, that, like Tim Pool, Jack Posobiec, whatever, I all mentioned in what we wrote. Like it's, but they never tell you, like these people who have these criticisms of China never tell you, oh, right, IBM was there since the 90s. Like, oh yeah, HP was there since, like late 80s. Doing this and setting that up, and look at how many billions of dollars were put into this research and development in these different fields. And then if you go to the next one, it's the Digital China from 2006. I'm sorry, no, 2006, and the Royal Society from 2004. And I just put them side by side because so the one from the Royal Society in 2004. They're talking about the same things, right? It's all like nano and synthetic biology and all that, and their plans for the next 20, 30 years. And they're pretty much identical, but the one from the UK actually came first. So it's just interesting, like when we think about like, oh, China's going to take over and doing this and that. It's like, are they? Because let's look at the fine print here. Like, let's look at like when these like reports are coming out, and who's kind of setting the tone here, like. It's just I just wanted people to think about that. So
yeah, it's not as simple as it's just not as simple as it's China versus the United States. It's like in a sense, sure. In terms of like let's go with like control of satellites, stuff like that. But then you have all of these businesses and just the fact that the Chinese, any business in China is, the state is obviously involved in that. That's how China is. You can't say it's much different than here now at this point because of our love for public-private partnerships. But the point is, this is all still profit-driven. So governments really are becoming, and this is by design, less and less of a pillar of, we knew that, but like governments are not going to be seen in the coming years as like the arbitrator of the truth. They are just a stakeholder in this multi-stakeholder approach to governance, governing the world. And so again, it just goes back to the fact that let's say you have a politician that's like, Medicare for all, blah, blah, blah. So that means, by default, then they're into all of this data collection and such and what it's going to be used for, how it's interchanged with things. Those questions aren't really, these types of issues aren't being asked to those politicians. So I don't ever really want to knock people that are, they put their faith in a lot of these politicians. It's just remembering, okay, there's a lot more than what they're saying here. Maybe we should look at the fine print. Because I know this is a ton of information for people, but seriously, this is what they're really not talking about. And it's for a reason. Division, it's so easy to control people that are divided. We all know this. So you have to kind of take a real far back step at, like on a macro level and see like, okay, if they've lied about this, they've lied about that. Is it really the United States versus China all the time? You have so you have all this like interchangeable relationships that they have with this research that's being done there. So
like especially with Trump, right? Sorry, like with with Trump was he was saying like, oh, we're going to get all this all this all this technology. We're not going to export it to China anymore, and we want this and that back. But it's like you funded it,
right?
You funded you funded everything. You funded everything.
Could it be?
It's like, are you kidding me?
Right. Like, could it be that just the research period was over, and that's why it was just real easy to pull out of China? You know what I'm saying? There's all kinds of factors. It's like I'm just I'm tired of hearing just these like one-liners that are good enough for people. Exactly. We're gonna come back to America. Yeah. Okay.
Yeah, we're gonna bring the jobs. Like, okay. Like, first of all, like, why does half of this technology even exist?
Correct.
Like, why? Because a lot of this is very militarized, and like we're gonna go into that in a second. But yeah, but we can go to the next slide because it's I'll just like tell you briefly. This is basically like China's 2025. I guess industry innovations, and then I put it right next to the green innovations of the UK. It's just there's a lot of similarities, and I think that's what I'm not trying to tell people how to think or anything like that, but I just want to point out that like these so-called adversaries, right? They seem to have the same goals. So
it's interesting.
Yeah, it's just interesting.
Yeah, we like to plant seeds, just little seeds. You can, if this interests you, just look into it tomorrow. You'll be horrified at what you find. So.
Oh yeah, and then this over here, they were talking about how blockchain is going to be like in the front lines against climate change. Like just like the corporate green movement. Yeah. So I believe let's see. So they're basically trying to. Even the World Bank is saying this that the blockchain will be great to keep. Well, they say health as well. They say health to manage health, education, cross-border payments, and the carbon market trading, right?
Yeah.
I know, Franco, you have a lot of issues with with the green,
the
green movement, and people not talking about it in a real way. So I just thought that it was interesting. The World Bank thinks that that the blockchain is going to save us from ourselves.
Yeah, those people telling me. That's I don't know. I don't trust them. I don't trust when people lie. They don't just change overnight. So. Yeah.
We're entrusting the destroyers to all of a sudden save us now, right?
Exactly.
Using these tools that could easily be used to take advantage of us. All right, here's Australia, which you guys were saying you guys wanted to get to, but yeah.
So this is just Australia and Canada, kind of like another two Commonwealth countries. They're both at least two major international exchanges. The Australian Securities Exchange and the Canadian Securities Exchange are working toward fully blockchain-operated trading and clearing environments. So they're basically like they're totally on board with the, or not the people, but their governments, just as far as like using blockchain in the trading world. And in the next slide, you'll see that Australia's first blockchain bond came about just in 2018. Was the kangaroo bond.
There you go.
Through the World Bank, and it was an impact. It was an impact bond, by the way. So it's like a development impact bond.
Yeah. So you're paying. You're investing in an outcome that will be easily achievable, therefore you're going to get a lot of money. Well, not you, the person that's this is being used on, you meaning the organizations, government, and private investors.
So this ties a little bit into what I was talking to Robbie earlier about how these politicians have a lot of insider information.
Yes. Yes, they do.
Yes.
That was So
Australia. Go ahead.
Yes.
I included this one because they were doing I added this one last minute, but it was like so this is in Australia. It's called Health Tracks, and this is from 2014, and it's a web-based geo-visualization of spatial information to support evidence-based health policy, and basically the overall aim of the Health Tracks is to project. Or the Health Tracks project is to make spatial health information more accessible to policymakers, analysts, planners, program managers, to inform about health situations. So it's basically in order for them to understand things on a I guess in a detailed way, they were going to use what do they say? This process has been expedited by bringing together multiple data sources, making them available online in an online geo-visualization health track, which consists of mapping and reporting. So it's basically health data. Like and this is what they're using for COVID right now to track like which neighborhoods or there's an outbreak, or like what's going on here versus what's going on there. Like who do we need to arrest there? Who's breaking these COVID who's measures, right?
Yeah.
So a lot of that like authoritarian like just stuff that you're seeing coming out of Australia is being helped is being partly facilitated through the healthcare system as well.
Yes.
Because they do things like this through the tracking. So it's hard to like even realize this stuff unless you like really look into it and try and understand satellites and like Internet of Things and AI and all these other things and blockchain and machine learning. But if once you kind of put the puzzle pieces together, you're like, holy shit, this is pretty obvious. Like no wonder like Canada and Australia they're going through what they're going through right now.
Yeah.
So I just wanted to point that out.
So then, like what Tulsi was promoting, since she was saying she wanted the Australian healthcare system, there's potential for what's happening in Australia and Canada now for it to have happened in the U.S. Despite having this this type of single payer.
Yes. Right? Yes.
Yeah.
So it's just
so nothing was good enough for these politicians were promoting.
Yeah.
We're so beyond the pale. Wow.
Yeah.
Yeah.
I wanted to say, Franco, do you have any questions yet? I mean, you've been no.
I've been keeping up, but let's see the audience. There's someone here that had a question. Let me see.
Chat.
So Ruby said, what was on that slide where there were similarities with China and the UK?
Oh, yeah. So that was from 2006 and 2004. It was the Royal, what is it called? The Royal Institute Center, and which is the UK's they have like different, it's a government organization.
Yeah.
And basically they have like a chemistry faction, they have, like finance, all that. And then I was comparing their nano studies that they were going to be doing and the, what is it called? The protocols for that. With what China was going to be doing with this paper that they released in 2006, 2 years after that. And it was like exactly the same thing. Like literally exactly the same thing. It was like China's plan it was like medium term and long term goals from 2006 until 2020. And a lot of it was nanotechnology and synthetic biology. I just thought that was interesting. That like 2 years before that, in 2004, and all of this is also in the article, and I have all of that like sourced. So if you want to go into it and look at all that, like it is there. So
yeah, all of this info is in the article, but
exactly.
Because as far out as some of this stuff is, we made sure to we have receipts. This isn't just some crazy. It is crazy.
Everything is very well
up.
documented, just like a good journal or just like a good article is supposed to be. So what is this impact investing?
Oh, Allie, do you want to talk about that? I just added that in there just so
I mean, we might
we pretty much.
So you're going to see a lot of this. I mean, it's already existed, and again, this kind of came from the Obama era. It's essentially the people, the World Economic Forum types, the consulting class, like some of the McKinseys, the Deloittes. Then you've got just the old guard institutions like the Council on Foreign Relations. Groups like that. You saw they're essentially coming up with a way to rebrand, like I said, making money off of us. So they've, I love how COVID has been this realization for all of these people. It's always on the World Economic Forum website. Like COVID has shown us that things were just, they're just bad, inequitable, blah, 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 blah. As if they are not the reason, they did not, as if they are not the ones that set up this system that is structured like this. So that's kind of how we got here. But they're still trying. So a social impact bond is essentially, it's paying for an outcome based. Yeah, there's a million different names for it, but you'll see this a lot, and it usually involves multi-stakeholders. So you'll have the government, you'll have an NGO, and then you'll have like a JP Morgan, something like that. You'll have this like a trio. And so you'll have a group that's deciding measures. So like the governor of Illinois, actually, at one point, there's a social impact investment that he was part of, and it was about education, and it was like getting like a group of like 100 kids better quality preschool. So who's setting those quality measures? The same people. So then they open this up, they have the program, and they say like, hey, look, we met our metric. Then the people backing it, like the JP Morgan group, they are going to get a return on that investment. And the federal government or whoever is, benefiting from this doesn't have to spend as much in the long run because somebody else, like there's so much money involved that like it was going to happen no matter what. That's kind of a way to explain it. I mean, the thing is, you'll start to notice like patterns when you look at a lot of these programs, especially that politicians will be in, like a lot of like non-profit stuff. They're all in it. It's all like everything's essentially a social impact bond. So hopefully that makes sense. If not, we can talk about it more. But it's essentially people, like investors, that are deciding an outcome for a group of people that have, some kind of disadvantageous situation, and then they're defining what's better for those people, and then they're making money off of it. So,
but this is being done globally. This is a global situation. Yeah.
Yes.
And it was started by Sir Ronald Cohen, like the first social impact bond. It was in England. It was done to, I guess, reduce prison recidivism. I guess in Edinburgh. This is back in like maybe mid 2000s. So that was done there first, and then it came to New York at Rikers Island after that with Michael Bloomberg. And Goldman Sachs. So they did it with Rikers Island prison. I guess that one actually didn't really work out that well, and they said so, but they were like, oh, but we're just gonna have to try again. So
they didn't have enough people. That's why they didn't have enough people. It was like, I think it was an attempt to the recidivism for like juveniles. So it's like, so you need more. You need more people then to be in these bad situations that you're supposedly trying to prevent. You're just really making money, and that will most definitely occur in the healthcare system as well. There's already some programs set up where it's profiting off of
and
a bad situation.
And they're doing this internationally already with Sir Ronald Cohen's company called Social Finance. Do you want to look into it? Because they do it internationally as well. They just opened up, or they just signed up with a partnership with this NGO in Mozambique, because there's been 800,000 people that have been displaced in the last 3.5 years. So this happened a few weeks ago. But yeah, so it's just the impact investing. And Sir Ronald Cohen, he also is the one that he was like, I guess, head of Apex when their like pensions, all these people like lost hundreds of people lost their pensions and their 401ks and stuff while he was the CEO, or I guess he was like up there. I don't know exactly what he was at the time. I forgot right now, but so he has like pretty much been in charge when people's pensions and shit have like sunk, but for some reason he's going to be, he's like this pioneer for like for this new social impact bonds and stuff. And I would implore people to please check your if people have 401ks or pensions and things, check what you're invested in, because I bet you that 9 times out of 10 it'll be an social impact or development impact type of investment. Because a lot of people, that's why I'm saying this is all of us, because if you have a 401k, if you have a pension, you're investing into this. It's all mixed in. It's all mixed in.
So. They've designed it that way. It's not so. Yeah, you can pick out the people that like the Klaus Schwabs of the world, but it's the system. It's the structure of the system that's how it's all kind of like baked in there. So it's like we're all part of it. So fun stuff.
We can skip to to 34 if you want, because we kind of just talked about all this.
Yeah.
Biodigital convergence. Sorry. Yeah.
Which one's 34?
Or the one that says biodigital convergence. Like, go up a little bit.
Yeah. I think
all right. So right when you introduced biodigital convergence.
Right before that one.
Here?
The one right before it.
Who are these
before
people?
That one.
Oh, okay, right here. Okay.
Yeah, that one. Mm-hmm. Thank you.
Yeah.
So so the biodigital convergence comes ahead of what are they called? Events Horizon in Canada. Good old Canada. We always think of Canada as this like nice place, right? Like They have healthcare for all, and the people are so nice.
Right.
They have maple syrup. They're so sweet. It's like, but so this comes out of that. So it's called digital convergence, and it's basically changing human bodies and minds and behaviors to changing or creating different organisms, altering ecosystems. How to they work on sense, store, process, and transmit information. How to manage biological innovation and things like that. So that's what they officially say. We can go to the next one. Sorry. And then even on their own website, they say, Policy Horizon Canada uses foresight data to help the federal government build stronger policies and programs in the face of an uncertain future. So that's how they...
Yeah. Just think about this on the biodigital convergence.
Yes. It is literally, yes.
Yeah. So go ahead.
So basically they say there's like 3 different ways. It could either be like full integration of full physical integration of biological and digital entities, where like the digital technology can be embedded in organisms and biological components, or it can be co-evolution, right, of biological and digital technologies. So it's like this type of biological convergence emerges when advances in one domain generate major advances in another. Or you can do it the third way, which is like a combination of both. But go ahead.
So an arms race, as we keep evolving, like this technology will digital technology will keep evolving, like within us.
Yeah. Fun, right?
We're converging. We're
becoming one. Yeah.
We're becoming one with it. And this is coming from the government of Canada, by the way, from Events Horizon.
So that's how they're defining co-evolution?
Yes.
So the merger?
Yeah.
The bio and the digital. Because they want to be able to predict you, because biological beings are so random sometimes. They act so irrationally. Let's bring the digital world into it. Let's integrate the two. That way we can make people predictable.
You can easily see the many benefits for the powers that be to have a society of people that are just docile and not, free will.
Obedient workers.
Exactly.
It doesn't matter what their happiness is or what they want to fulfill, like in life or spirit, or what they want to fulfill spiritually. What matters is how much work they put in, so that we, the ones at the top, can profit off of all that. Yeah. So we can enjoy and be happy, but not them.
And then pretty much. And then in the next couple of slides, they talk about the capabilities of biodigital convergence, and they talk about altering human genome. Like our core biological attributes by advances in gene sequencing through CRISPR. I'm sure people have heard of that. I think it's the slide right before that. Sorry, Franco. And then they also talk about monitoring, altering, and manipulating human thoughts and behaviors. So I guess that would be done through cybernetics.
So you're not paying attention in work, right? So they can do that, right?
Literally, yes. And then this will be like through neurotechnologies, read brain signals and monitor attention and manage fatigue. And they also talk about changing and eradicating species. And they say like, oh, well, look, like we can eradicate the mosquitoes in Africa, right? They're causing malaria. So they were doing these like genetically modified mosquitoes that they released into Burkina Faso, which is a country in Africa. But then it's like, well, hold on. How about the genetically modified like mosquitoes? Like, what are the problems with them? Like, what if they bite? Like, what happens then? You know what I mean? Like, what is that? This doesn't make any sense. Maybe it does. Maybe it actually worked, but I highly doubt it because look at the people involved.
Yeah.
Then they also talk about altering the natural environment at scale and predicting and managing the spread.
The spread of organisms.
Yes.
Okay.
So
it's just more. They're just attaching a dollar sign to everything possible, like in nature, just everything. Again, like just I keep going back to like the bigger points, the takeaways here. It's like everything that makes us human, it's becoming less and less like our choice. It's like they are so invested in the things that make us human because they want to make money and can control. Go ahead.
Are they trying to do this to not just humans but to animals too, so they can be like,
nature,
okay,
all of life.
So they're like, all right, this species is invading this other, it's an environment that it's not supposed to be in. Let's try to limit that population.
Yes.
But how do we know the right people are determining whether
Exactly.
this will be, this will actually be detrimental.
They're playing
Exactly.
God. They want to
And
play
then
Yeah.
they
God.
could, yeah. And then us humans, it's like, oh no, we're not allowed to spread and reproduce over there. So
Mm-hmm.
they have a say in that too.
Yeah, and they'll have your genome
Mm-hmm.
on the blockchain. So,
That's
like you see
right.
how all this like starts to connect
This
when
is
you're like,
some
what the fuck?
dystopian stuff.
Yeah. Oh yeah. It's horrifying. And again, just
Yeah.
look at the article. That's they'll tell you right in their own words.
Yeah, exactly.
Storing data and DNA.
Yes, so they can
So
do this now. So the
via
this
what?
doctor, so via the biodigital convergence. Um, Franco.
Oh no, I meant
Dr.
like what
I know.
biological system are they using? Like reverse transcriptase, or
So they
they
would.
like
So
gonna use
basically,
CRISPR?
they would use like they would. So since like the computer algorithms or whatever are made out of like ones and zeros, and then DNA is like made up of like the 4 different letters. Like so, like each letter would
Yeah,
be like A would be like
GTA
yeah,
and
exact and
C.
T. Yeah, GTAC. Yes, exactly. So like A would be like 00, right, on the computer, and then like I guess G would be like 01. So it would that's how it would be done, like on the if you're going to be sequencing DNA digitally. But the Yaniv Ehrlich and Dina Zelinsky, they're from Columbia Engineering and New York Genome Center. They developed a technique that enables them to fit 60% more digital data onto a given strand of DNA than was previously possible.
Yay.
So, and they talk about the new ways to store information in biological systems. And they even talk about, like we can store your electronic or your health record in an implantable, like chip and put it in your body. It's like, why?
Right.
That's weird. I know it sounds
Don't
like
want
kooky.
that.
I'm not saying all this is gonna like happen. It's just interesting the way that they're thinking about things.
Mm-hmm.
And these aren't just like random people. This is the government of Canada, which is essentially the UK, which is essentially NATO. So
Yeah.
so that's how I'm. Yes.
None of this stuff is focusing on preventative care. Like,
No.
oh, you can eat the right kind of food so you can prevent this disease. Like, there's endless amount of information out there, and things that we've been doing for thousands of years, like holistic medication. And we have even more information now with the internet and everything. More, like there's more scientists that can look into this so that people can have an efficient diet so that they can prevent autoimmune diseases or reverse autoimmune diseases. But no, they don't want to focus on that because then that's money lost for them.
Correct.
Take iodine.
Yeah.
Get rid of all the fluorine. Yeah. So, this needs to be understood as a militarized operation. Period. It is full spectrum dominance from the satellites to the ionosphere to like the Internet of Things to the sensor technology to your cells, like to the very components that make that you're made of physically. So it needs to be understood as that. That's what it is. As they say, modern warfare is a joint warfare. Like 5G technology marks a critical pivot for spectrum policy, technology innovation, like AI. They're talking about cloud-based data. Like this is all military.
Yeah.
So go ahead, Alex.
No, I was just gonna say. I mean, think about just to bring it back to something like COVID. Like from day one, I was like, that's weird. Operation Warp Speed. I was like, so this is a program to deal with the pandemic, and it's through a military operation. I'm just like, does anybody see it? Isn't that weird a little bit? So it's just, think about how everything else our government tends to handle. It's a military operation in a sense because the control ultimately is for the data because, to control a populace, you need to have the data. And it goes back to the question of just because you can do something, does that mean that you should? And in none of this, again, we're not seeing anything about ethics in terms of how this is being implemented, rolled out, nothing at all. But you have again, I'm sure that will come up at some point in question, and you'll have the same group of people who's running all of this. They'll have an ethics board, especially like in the Biden administration, because, the Biden Obama types, they love a good old, like a task force to deal with something or an ethics board. And that's essentially just green lighting, things. Be like, yeah, sure. We had we have a task force. We have an ethics board that deals with this, and they can check the box and be done with it. So go ahead, back to the military operation of this. It's horrifying.
Yeah. So I mean, the first one, it's just the DoD released this just recently. This was like back in I think November or December 2020. Just talking about like full spectrum oversight of like what is it, electromagnetic spectrum operations. Like we need to be in pretty much, I guess they need to dominate and control every spectrum of like what from the radios to the satellites to just everything, everything. So the next one it's talking about like land, air, and this is coming from this is all government. I took all these pictures from government documents. Talking about full spectrum dominance. That's what they call it. That's literally what they call it. Zero sum games, fight to win. You know what I mean? Like America first, whatever. But not really America first. Like not the American people though. Just the ones that comply and exactly.
Yeah, I keep laughing.
There's nowhere you can run where you can hide from the
Exactly.
military.
You can't. It's like
you can't
air,
even go to
land,
space.
sea, space, cyber. Yeah.
And you really quick, you could even tie this like to something like just with activism. I see lots of groups that which is great, but like coming up with strategies. We know some people that really enjoy coming up with strategies. Gentleman likes to go around to different groups and say like, how are you going to organize? Well, how are you going to organize when you've got sensors everywhere that can monitor every single movement that you make, and I'm not kidding you, in time, every breath that you take, every movement, everything about you, and every piece of technology that's on you is already communicating with another sensor. That's, this data is all accessible in very real time, and it's very proactive, meaning if you're hitting a mark of this, thank you, Indy. I just saw the comment. So my point is, you can't really organize if you can't even walk down the block without being tracked. And it's not to say that we're not already tracked. Like the phones, they can already do that. But the problem is that you've got the Internet of Things rolling out, meaning these devices are talking to each other proactively. The human doesn't need to push a button to make one device talk to another or talk to that sensor that's going to trigger an action from God knows what. It's truly surveillance, like it's dystopian, and that's putting it mildly. So I hope, and I would love to, be a part of this too, is just like more and more activist groups also include, you can say the surveillance state, but it's so much bigger than that to me. It's like, you're saying full spectrum dominance.
Full spectrum dominance, yeah. From your very cells, like from your very being to the ionosphere to space. Straight up. And that's why, even if you look at it, the satellites, like nano satellites market is booming because they're sending these satellites up there every day, every week, and just surrounding the globe. Eventually it'll look like Venus with the thing around it, but with like satellites. Like seriously, it's just it is a global capture. No, don't get it wrong. It's not China. It's not Russia. It's not America. It's not UK. It's not the people. It is an entity that has been planning this stuff for a long time. In its own way, like a structure, and it moves like a structure, and they're very sophisticated with their propaganda. So we have to remain vigilant.
Yes. Are you trying to say that we're gonna have like rings, like how certain planets do?
Yeah.
So like Saturn.
Yeah, it could happen. No. I mean, I'm not an expert. I'm just saying it. Like it literally, like the way that that it looks when it's going around, because
polluting space.
Yeah, especially the nano satellites, like those orbit the Earth.
Yeah. So, yeah. And really quick, who's going to be monitoring? Obviously that's a military operation. For these control of different satellites, or like coming into another powers like orbit. You might also have some issues, and this is an entirely different topic, but real quick, what if something collides? What if something, like all this stuff they're doing up in space, that's going to come down somewhere. So that's a whole other topic, but more again. And I just saw that the military,
the atmosphere. You're right, Allie.
That's a whole other scary.
Breathe that in. There's like nano particulates and shit.
Yeah. So
all these assholes like Elon Musk and Jeff Bezos want to have their stuff like floating around in space, and Eric Schmidt also, Bill Gates, like they all want their satellites up there.
Yeah.
I mean, these people are also connected with the military. I mean,
Yeah,
Correct.
you got Jeff Bezos and the Washington Post and the our the Pentagon,
Yeah.
right?
He does I think the computing for them too. But this is just kind of goes into more detail about like the air, the land, the sea, the cyber digital world and space. And it's just kind of more of a detailed. And then the one after that, they talk about sustainable electromagnetic.
Of course.
They got to add a spin on it so that people are like, oh my God, this is environmentally safe. It'll be good for the environment.
Must be good.
I mean, this is just obnoxious. Like at that point,
Yeah.
like I couldn't insert the emoji, but I just had to put an eye roll.
It's just good because it's always sustainable. For good. We're doing it for good.
Sustainable, like what is it? Full spectrum dominance. How's that? How does that work? You know what I mean?
Right. Right.
What are we talking about
just
here?
Everything earthly, everything earthly is becoming. They really truly want to control it all. Like
all of natural life.
Yeah, but oddly enough, I still have optimism. I'll get to that at the end. But I don't want people to walk away from this and be like, wow.
We got to understand what's going on before we can talk about solutions and how we can overcome this stuff. But yeah, it sounds doom and gloom right now, but we got to figure this out, how our enemies are operating, and then we can structure a plan to take power back.
And there were just two more slides. But this one was about so you're not supposed to militarize space, right? Because the UN, like when they had the charter or whatever, they've spoken about this. And I think they've even tried to bring it up again recently, but it got kind of shut down by the NATO countries. So it was saying like early proposals for prohibiting the use of military purposes and placement of weapons of mass destruction in outer space. So there's really no, they tried to implement something, but there really isn't. And also like, does it really even matter? Because look what they do.
Right.
I mean, and then I wanted to point out that even back, I guess it was back in 1972, they had the Anti-Ballistic Missiles Treaty, which was signed 1972 by all the countries in the UN. But then the US pulled out of that in 2002. Just wanted to let people know.
Of course.
So, yeah. And then the last thing was just kind of like everything that we've been talking about. It's this thing they call the spatial web, which is basically like, just with like all the sensor technology, right? Kind of interacting with each other, getting like layered onto like the physical world, more or less, like the way that you interact with it, it gets layered onto the physical world. They kind of want to make a digital twin of everything in the physical world into the digital world. Not saying it's going to happen, not saying that like it's a done deal, just saying that this is what they're saying they want to do. And this is coming out of Deloitte, which is one of the big four auditing companies in the world. So
they advise every business. Yeah, go ahead.
So just basically like, and when I say everything, I mean everything, including you, including like your blood, your like your organs, everything, down to like the bolts that go into making like a building. Like it's going to be in infrastructure, it's in everything.
Yes.
Yes. So it's all connected. Go ahead.
I was going to mention like Elon Musk, for example. I remember specifically he went on Rogan. It was maybe last year, and I remember this part because I like to watch this because I want to see what the hell he's talking about. Elon, that is. And he said something, it was about if you can't beat them, join them. And I was like, that's okay. Like, because he does that a lot. He'll say things that it's like he actually is really telling you. So I looked into that further. And of course, with his Neuralink, which is like that, essentially that like net that works. It's like another layer of your brain. So you see all these layers
on the
here.
Chimp, right?
Yes, correct. So that's another way to like converge you with this creepy techno world. So and think about this also, just to end like with the spatial web, and everything like having like a digital twin of yourself. Like capitalism obviously they've rebranded it, of course, but a lot of it's it's run its course. Poor people don't have money to buy more of their shit that they're selling us. So what better way than to take it into the digital world? And your digital self is almost like you'll be making money in an entirely different way. I mean, you saw Mark Zuckerberg. I was just talking about this VR. I'm not saying the term correctly, but it was some kind of VR system that ultimately will just be hanging out at. So like, who knows, you'll get like a token for like doing this, and that's going to, then allow you to access more in this digital world, which people like Mark Zuckerberg are completely fine with. Just Like imagine going to like meet your friends for a drink at the virtual bar because you're not, for whatever reason, going just to the normal bar. It's because you don't have money or whatever. There's a million different ways this could go, but it's again just being aware of the technology that's out there and what they think will happen with it and how it might actually go.
And it's essentially, it's like the kind of to add on to what Ali was saying. So when you do have the digital twin of yourself, once you get on the blockchain ID, like once they get that rolling, which I think is what the COVID passports or the vaccine passports are about. I think it's more about like getting everyone into the system than about people taking it, because they want to get you into the centralized, decentralized, centralized database, or ledger. So that is going to be like, that's going to be like them taking out like a little piece of you, like the physical piece of you, and you're going to be on this digital piece, and then you can be traded on there, like a commodity. So it's like inverted capitalism, or what I wouldn't even call it capitalism. It's just like like neoliberal economics. Yes. Yeah. Like neoliberal economics on steroids. Yes.
In a creepy dystopian world.
Yeah.
So yeah.
So this reminds me of like when you guys talk about digital twins, right? Is that like uploading like a digital version of yourself that can do stuff?
Your digital twin would basically be everything that, like, who you are. So if you get on the blockchain ID, right, it'll be like your health record, your anything that you're like all the Internet of Things things that are connected to you, and you know with the higher G towers that are around that that will so like help with
all the information about you.
Yeah,
everything. Yeah, your education, everything will be like that'll be like a token, right, in the blockchain. Like, so that's how you're going to be tracked in real time. Like that is the full spectrum dominance aspect of it. And then if you have like things tracking you on the inside, like if you have like, I mean, I'm going to, not to sound crazy, but literally like nanorobots, like inside of you that are tracking.
I mean, we're looking at all this nanotechnology and stuff. I don't see why they wouldn't be able to track you with that.
And they can.
So yeah, in the wrong hands, like with all the information possibly that they can have about you, imagine what they can do. Imagine what they can predict. They can design all these algorithms about you and make, be like, they can also predict who can be a threat, right? Who's going to be an actual threat to, our agendas.
Correct.
And our status quo. Like, who do we need to watch out for the most?
Yeah, based on patterns, different things that, like, even just like,
what are they looking into?
Right.
Like, they're looking too much into our plans. They're talking too much about what we want to do in our future and what we discuss in the World Economic Forum. We got to do something about these people, or make their lives hell, to make them stop.
Yeah.
Yeah.
So like, what Ali was saying, where she was saying, like, we got to start talking to. It's not just the people at the very tippy top, right? Like, it's not just going to be Bill Gates or Klaus Schwab or even Epstein. Even though and it's okay to talk about those people. But that's not it. That's not that we have to be talking to like everybody, right? Like your next door neighbor who might be, coding part of this thing. It could be anybody. So it's just I think that it's better, not better, but I think it'd be more beneficial, maybe, in my opinion, if these like the structures of it can be exposed in a real way, so people can understand it, rather than just like, oh, like these 4 people are bad and we need to talk about those people all the time. You know what I'm saying?
You need to understand the systematics of it, and what they're up to, how this affects us, how this affects a bunch of other things. It's a whole network. But yeah, before you guys, hop off here, what are some solutions to this stuff? Because we can't just leave people here feeling doom and gloom.
Yeah, I don't want that. I do. It's weird. I think I don't want to speak for Sebs, but we do like to enjoy. I love researching, like just finding all these like little things that people may have missed. But sometimes you get yourself into such a horrifying place. You're like, but it's important. It's important information, and I don't want to make it seem like, oh, they're not covering this. Like people are busy. People have shit to do. It's here. Planted a seed. If you're interested in any of it, reach out or just research it on your own, however you want to. And there's, there are other people out there talking about this. But I would say solutions in the meantime is to tie it back to something like healthcare. instead of saying, well, this politician said that they support Medicare for all. Lovely. What the hell does that mean? Like, ask some like deeper questions of these politicians or of these groups that are the nonprofits or just like little political organizations that are out there marching for healthcare. Again, that's great, but let's dig a little deeper and put the people that are not giving healthcare to any of us, let's talk to them a little more and see what they think about things like this, because I guarantee you many of them don't even realize what the hell that it is that they're backing. And that's a problem, because you have these huge bills that come through, damn well they didn't read all of those all day. Like, it's like logic here that we're just kind of missing. And so it's even just following up, if you're interested in electoral politics, following up on that, or if you're like a member of even something like DSA, which is in Medicare for all, like their thing, talk to them. It's like, it's just pressing more people to understand this huge data grab and what that means in terms of our healthcare and how that's going to be rolled out. You can even look into just making it more known, different companies that are investing in healthcare solutions for the future. So it's just kind of noticing more and more of the players and realizing that it's not just as simple as like, Republicans don't want to give us this, but Democrats will. It's so much deeper than that. And that's all just kind of a show. And honestly, it's just coming to terms with all of this, because you can't really solve a problem until everybody at least has an idea of what the problem really is.
And then simplifying it that way is what the oligarchy wants us to do.
Yes.
They don't want us to go deeper into it. And because then we start realizing that it's all an illusion, all these theatrics that the two parties do. But yeah, I think I would say we start by informing people about this stuff, just like how you guys are doing wonderfully. Share that information out and then discuss to people about how you can opt out of the system, because we really got to take money away from these corporations, and electoral politics is not doing it fast enough, nor it's doing the opposite.
Yeah.
It's giving them more power. So that we really got to hit that message home to people.
Yeah.
And we have to promote more shows, I guess, that are talking about solutions. There's not that many. There's still a lot of shows that are stuck talking about surface level criticisms about the establishment by only talking about what the mainstream media is saying and criticizing just the politicians. We got to go a lot deeper than that.
Yeah.
And we got to talk about what we can do to engage with our community, to be more dependent on each other, with growing our own food, or having our local mechanics or whatever. There's a lot of examples that we can do that are out there that we can opt out of, and stop depending on the corporations. But yeah, go ahead, guys.
Well, I mean, the last thing I was just gonna say, it's a lot of the stuff we talked about today doesn't mean it's like set in stone that it's all going to happen. A lot of it will. But some of it's just like, okay, where do you think this will lead based on the people that are involved and the systems that are in place? It's not to say that there's no hope, but it's again, just going back to that aspect of like, you don't have to think of things in a choice, like how it's always framed to us. It doesn't have to be like this, but it will take us, again, just accepting the reality that like we are entering into a very, very dystopian era that I don't think people will see coming in terms of like how it's presented. It'll come with, a smile. I think I accidentally just kind of quoted Ronald Reagan, which I didn't mean to do, but
How dare you?
I know. All right.
but aren't we with all this, isn't it make you think how we're in the dark ages? Like, we're not consciously advanced yet. Like we're technologically, it seems like we're advanced, but consciously we haven't figured out a lot of things.
That's where I'm just kind of hoping at this point. Like, it is the age of Aquarius, so then I'll get all woo-woo. It's I won't go into that, but better hope so.
James Giordano was even saying, the guy was telling the Georgetown bioethicist, whatever he called himself, neuroscientist. He was saying, "Oh, we don't really need to understand consciousness. We have data. We don't. We don't need to understand like what that's." We can we can predict what it is based on the data that we have. So
So consciousness is a lot more complex than data can ever give you.
Yeah,
data is limited.
And the last thing I want to say, just like really to drive home the point, it's like our humanity. This might sound dramatic, but really and truly, everything that makes us human is up for grabs. And free will, it's just the idea of humanity is more and more becoming less of a foreseeable future. That's horrifying. So if anything's going to motivate you, it should be just your own free will.
Absolutely.
Yeah.
I agree. And I think like my last thing was just with a lot of these different technologies, I'm not saying that they're inherently bad or anything, but they are being used in a militarized way. And they should be understood in a militarized, with a militarized perspective or frame of reference.
Yeah.
Because that is where they're coming out of, like, number one. And number two, like, it's just, it is an operation. So
yeah, why do we have the Space Force? Okay, I'm done.
So
yeah, but thank you for
Absolutely.
Thank you for having us on. Hopefully people aren't too but it's there's a lot
they're
there.
definitely gonna have to digest. I'll probably make a shorter video summarizing all this stuff, so it's like a trailer, so that they can dive deeper into this stuff. But I'm sure people will be interested, and people will understand a lot of this stuff. They're probably gonna watch it multiple times, but also reading the information can also help some people absorb this. So one more time, people can find Ali Alexandra on her Substack here, and they can find Sebs in Solar Tsunami on Medium. But yeah, where else can people find you guys?
So you can, it's right there, my Twitter handle, Ali Alexandra, 2 A's. I did change it, so there's not this awkward, there was like 5 underscores in it before. So long story short, you can find me on Twitter, Ali Alexandra, 2 A's, and then my Substack as well.
Yeah, same here. Red Sea Cactus on Twitter as well, and then Solar Tsunami on Medium. But thank you so much, Franco, for having me.
Yeah, Frank, thank you.
Sorry to be like all. I wasn't trying to be doom and gloom. Just happened to be that way. But
no, this is just we're presenting the information. The way that we interpret it is going to be doom and gloom. But I mean, that's just how we are as people.
And
but yeah, guys,
everything we said was right. It's just more like this is what how we see it. That's all.
Yeah. Mm-hmm. All right, guys. Thank you so much for watching. And Ali and Sebs, thank you guys so much. You guys can also find us, sometimes hanging out on Discord and on the Yellow Brick Road channel, which are watching us right now. Shout out to you guys.
Shout out to the Yellow Brick Road.
So yeah, take care, everybody, and stay informed.
Bye, guys.